So how's it going, guys? So we got a significant language barrier over here. So this particular patient has been experiencing, facial paralysis for the past 1.5 years. And it happened before, after she had the birth of her child 4 years ago. And then this thing kicked back with a vengeance 1.5 years ago, correct? Right? So we'll do a close-up. I'm going to show you what it looks like. Okay, so we can see already the problems going on with, it should be symmetrical, but no, the muscles are not engaging properly on the left side versus the right. And also, you also mentioned about there's like, the face gets stiff and sometimes droop, right? Mm-hmm. Okay, same thing with the eyebrow too, over here. What about the mouth? Mouth too, a little bit? Yeah. Like, go ahead. Okay, so we also can see it's not symmetrical here as well. All right, let's go ahead, let's take a close look, see what's going on. So, we're starting with instrumentation. We're looking for any abnormal temperature due to inflammation. Inflammation will give out two telltale signs, which is localized swelling, also known as edema, and also abnormal temperature. And that's what this device will pick up. So we found one potential candidate at this level. And I believe we found another one in the mid-back. Right here. And I believe there's another one. Yes, there is right here. A small one. Right there.
Pain right here?
Yeah.
Gotcha. What over here?
No.
No. Got it. Okay. We got one right over here. The second sacral segment that's stuck. Hips are moving fine. That's fine. This fellow over here is slightly stuck, but not really. And we've got a problem here. See, there's too much spasm here, too much swelling right here. You hear that? Different, right? It sounds different here. So that's due to the swelling. So this is trouble. This is trouble right here. And a little swelling here. See, that's somewhat fixated. So here's a story. Whenever I find that's where we do full thorough assessments under the Gonstead method, is because even though there is a potential abnormal temperatures here, there is some swelling, there is some fixations, but this is not fully fixated. That tells me that this is a potential compensation that's trying to turn into a subluxation. So we'll confirm that on the X-ray, but I believe these are compensations over here. And they should resolve after we correct the major players. So right now she has a second sacral segment, and we're confirming on the X-ray over there. And there's something going on the seventh dorsal over here. We're going to confirm that as well. And let's see what else is going on up here. So after we correct these, I'm going to retest these over here, see if they still stick around or not. Okay, step back. Okay, so this is sticking like a sore thumb. Over here, you feel that big knot there, Senora? You feel this big knot? Okay, there's this huge swelling right around this joint capsule. It's huge. Right, there's almost like a size of a grape in here. The muscle is also very tight around here too. So the body try to protect something right here. So let's check. Yep, that fifth cervical is not moving. That's a brick wall. Yeah, everything was okay.
All right. So there are a couple of areas I identified beforehand. So we test confirmed there's a problem here, the problem this region over here, and the problem over here. Now, the reason why we're looking at bottom here, in addition to the top over here, is because just like foundation of a house, if the foundation is stable, house can be stable. And if it's not, everything else is going to come out of alignment as well, right? So all the components that we discussed earlier during the consultation, that she was also complaining about tightness and pain at the Achilles. So that also alludes to, okay, there's something going on in the sacrum, because that sacral nerve, it innervates right at the Achilles. So if there's a potential problem over here, it may cause problem at the Achilles themselves. So now we need to correct. The seventh dorsal itself provides structural support for the neck. But now let's talk about strictly with the neck itself. What's causing that Bell's palsy? Now, Bell's palsy, the particular nerve we're concerned about is this fellow over here. Cranial nerve number 7, the facial nerve. This nerve over here, as you see, it innervates certain areas like that, right? Now, we already can see on yours, I'll show the camera over here, right? This region over here is not working, this is not working right, and this is somewhat working, right? So, but it's mostly these regions over here. And this is chronic. It's been there for the past 1.5 years. So now here's the thing. Even though, yes, the facial nerve goes into the brainstem itself, there are some connections in terms of the mid part of the cervical region over here. And we identified on her that fifth cervical is in trouble. That's what we need to correct. We're going to realign this fella, take the pressure off that nerve, just like over here, alleviate the pressure off of that facial nerve, get it working again. Now, the fact that it's been there for 1.5 years, I'm going to see how much is going to be restored. Because it's been there for so long, it may not be completely restored itself, right? I have limits, because I'm not God, right? So your body needs to do a lot of the healing itself, right? So get it rolling. So just like we discussed earlier, this is what I see over here. On the sacrum, right over here, this one is supposed to be like this, gapped open like this. There's a huge gap right over here. That's what I need to correct. So because this became unstable, that's what we see the whole entire spine. It went this way, this way, this way, and then that way again. So we have all these curves going like that way, move over here, twist this way, twist this way, twist that way. Right? So, in order for us to correct that fifth cervical, we need to stabilize here first, the foundation. Right? Next component is what we talked about before, the seventh dorsal over here. We need to correct that one. And then the fifth cervical. As we see even here, the bone, everything started to tilt over this way from that fifth cervical. And over here, let's say the x-ray, you went like backwards like this, and a little bit this way. So we see over here, the tunnel start collapsing, and you're going to start pinching off that nerve due to all that swelling. The swelling itself, not the bone, the swelling itself will pinch the nerve, right? Because it's trying to protect this disc over here, trying to stabilize it, but has trouble doing so. So because it's been there for a long time, for 1.5 years or more, right? Most likely much more earlier than that, because you reported and says, oh, this Bell's palsy happened 4 years ago with the birth of your child. Right? So that problem's been there for at least 4 years or older. So we're going to do a much more deeper correction, trying to lift it back onto that. That's all. Okay. Right there.
Go. Just relax right there. Perfect.
Okay. How's the Achilles?
Yeah.
Any pain there?
No.
Anything different there? You like it?
¿Me trae?
¿Esa es una antifonete?
Sí.
Okay, bueno, okay. Have a seat. So dorsal still there. Look at that ninth disappeared. Let's check this third. Nope, third's still there. So yeah, now that's moving like butter, the ninth dorsal. So that truly was a compensation. Disappeared once you start correcting the major. Now let's check the seventh. Yeah, that's still stuck. We gotta fix that one. See, the third one is even more looser. So that's gonna disappear after I fix the seventh. All right, this way, Simona. Okay, I'm gonna put this up. Hey, look at that. That's subsiding. See, we took that pressure off that seventh dorsal. Check that fifth cervical. Yeah. See, you still have a reading at that fifth. Yeah. It's diminishing, but it's still reading there. See, now it's moving like butter. 7, 6. Yeah, see, the 3 is moving. Nice and well there. Okay, that fifth cervical is still jammed. That's not a happy camper. Let's go fix that. Right there. Let it go. Flat shoulders. Splendid. Okay, so, ¿qué es diferente? ¿Cómo estás? Okay. We're getting some improvement there. Before you were like really close eye like that. All right, try again. Good. Okay. So it's not as severe as before. We're making some progress there. That's good. Have a seat. Let me check at it. Yeah, got a little pressure still in there. See, we got most of the posteriority out. Now we just got to get the inferiority out. So, ¿qué es diferente? Okay, go like this.
Yeah. No. ¿De aquí cómo se llama? Yeah.
What's she saying?
Yeah.
Exactly, feel difference.
In what way? What's different about it?
¿Cuál qué diferencia?
Que no me no se me atora como te decía yo acá.
He said sometime before,
Mhm.
he can pull like that,
Uh-huh.
he can pull like that. Now you feel it, it's much better.
Yeah.
Nice. All right, have a seat. All right, now just relax. Close. Close. All right, so we got definitely team tape on. Open, close. Open, close. What is it? Close. Open, close. Open, close. Okay, open, close, close. No, open, close. Open, close, close. Head up, head up. Open, close. Open, close. Open, close. Open, close. Open, close. Good. Open, close. Open, close. Open, close.
Open. Close. Open. Close. Open. Close. Open. Close. Open. Close. Open. Close. Yeah. Open. Close. Close. Good. Okay. How's it now? ¿Qué es diferente?
Esto. Creo que el ojo. ¿Cómo se ve?
Oh, what's she saying?
The eyes is different. You feel it different. The eyes.
La boca.
Sí, sí.
Ujú.
How much better would you say?
¿Qué tan mejor tú lo sientes? ¿Qué tan mejor tú lo sientes?
50.
Like 50%.
50%?
Ujú.
Hey, that's a very good problem right there. Just something that's chronic that's stuck there for a year and a half.
Yeah.
All right. So yeah, this is gonna be a fun project. We're gonna keep working on it to steadily restore the nerve function to your face there. All right. Okay. We'll see you next visit.
Okay.
You're welcome.
Okay.
So, give us updates. How's everything doing so far?
Mejor.
All right.
De aquí está más, se siente más, lo sentía duro, ahora está más, tengo movilidad.
She said that it was hard for her, but now she's like getting used to it now.
Good, good. Now, she did report last time that there was a 50% improvement. How's it these days?
¿Cómo estás ahora en estos días?
Ya un 60, 70%.
Maybe 70%.
70% improvement. Okay. Can you go like this? Okay. Okay, let's show to the camera. Let's go closer. Okay. Good improvement. Let's take a look, see what we got. Hey, that's doing better. Small little reading. Let's see what we got going on here. Yeah, we still have a reading there. Yeah. Okay. How's this?
¿Cómo te sientes?
Me duele un poco.
She said it hurts a little.
Poco, ¿huh? Aquí.
Sí,
Aquí.
sí.
And it's still stuck there. All right. Let's check how this is. All right. Swelling has gone down. Hey. I'm liking this 7. Yeah. That's pretty good. So we'll leave that alone. Sit back. Yeah, you still have some swelling here. It's this angle right there. Got it. Yeah, you're progressing pretty well. All right.
So, ¿cómo siente?
Better.
Better, huh? How much better?
¿Qué tal mejor?
70, 80%.
80%.
Okay. So continue what we said just before. Ice this up. All right? Yeah, 20 minutes, 3 times a day.
Okay.
All right?
Okay, so el doctor quiere saber cuánto se te ha mejorado la cara.
Un 85%.
85%.
85% improvement. All right. Do it like this again. Like that. Hey, we're making some steady progress there. Okay. Still got a bit of pressure there. Pressure right there still. Good sort of. Yeah, still got that big knot right there. All right, there it is. Let's get to work. Just relax shoulders. Just relax. There you go. We want the latest updates. How is this area?
He said, ¿cómo está la área?
Solo no siento esto.
He
So-
said, yeah, that's the part you don't feel it.
So that region over there. How's this?
It's good.
Canta un poquito, ¿no?
Oh, this
El
way.
ojo ya no me llora.
Yes.
Okay, go to. Okay, making good progress there. Good. So just this region over here, so it feels some numbness. All right, let's take a look, see what we got. Okay. Okay, that's moving better. One below it. All right. Yeah, get to work on that one. Right there. Just relax shoulders. Just relax. There it is. How's this?
Un poquito más.
Poquito mejor.
All right. Keep icing this up. Okay, put the ice there. 20 minutes, 3 times a day. All right. We'll see you next visit.
Okay.
Right? You're welcome.